Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.
The host of Doc Talk. Tonight we have a very special Doc Talk that we're going to present. It's a town hall forum. In this town hall forum, we have a group of dignitaries here within Fayette County and in the Oak Hill area. With the numbers on the rise and seeing the Delta variant, we have a panel of experts that are going to answer many of our questions in regards to COVID-19. Our panel includes our health officer, Dr. Anita Stewart. We also have Dr. Scott Keffer, who is Chief of Staff, also hospitalist here at Plateau Medical Center. And we also have Dr. Clinton Curtis. Dr. Curtis is our Director of Emergency Room Services here at Plateau Medical Center. So the panel, I appreciate you guys coming on tonight in regards to the COVID-19 and the Delta. So I guess one of the questions I have just for myself is this Delta variant, maybe Dr. Stewart, you can talk a little bit about the numbers and kind of where we are in the community. You know, back in May, the Delta variant comprised about 1% of our COVID positive cases, and now it's on the order of over 90%. So maybe you can just give us a little introduction about kind of where we are now.
Sure, thank you. We are seeing an increase in every age group over the last 4 weeks and seeing an increase secondary to the Delta variant. Over 90% of the sequencing that we've had in West Virginia has been related to the Delta variant. The outbreaks that we have in Fayette County have been attributed to the Delta variant. So we are seeing those numbers increase. About a month ago, we were averaging in Fayette County 7 to 15 cases a week. Now we're up in the 40s, 50s, 60s again. And that again is increasing in every age group. The median age in West Virginia for COVID right now is 41. So, you know, last year when we were dealing with this, we were seeing a lot of older individuals being impacted. Now we're seeing younger individuals being impacted.
So Dr. Curtis, with you in the emergency room services, maybe you can tell me a little bit about what you're seeing and who you're seeing in the emergency room, vaccinated versus unvaccinated. Are you seeing any trends there?
With Delta on the rise, and just looking at the beginning of August, we've seen a dramatic uptick in cases, number one. There was a period of time where we were seeing very few cases, but in the end of July and in August, we've seen a dramatic uptick in the number of cases. Since the beginning of August to the 15th of August, we saw a little more than 40 cases in the emergency department, and roughly half of those cases, a little actually less than half, were unvaccinated patients. A little more than half were vaccinated patients. The severity that we see, however, those patients that are vaccinated tend to have less ill, and the unvaccinated seem to have a more severe course.
And so to you, Dr. Keffer, finally with you, because by the time they make it to you, they're pretty sick. I mean, now they're hospitalized when they get on your services. So what are you seeing with the Delta variant? Are you seeing an increase in hospitalizations? And if so, are these vaccinated and unvaccinated? So what are you seeing here at Plateau?
We had this really nice 3 to 4 months of no COVID admissions, which was so encouraging for us as a medical staff. But of late, we are keeping 1, 2, and even 3 COVID patients in the hospital. They are by and large unvaccinated, and the ones we keep have what we consider severe disease. So they have respiratory compromise and or pneumonia or significant laboratory abnormalities. Another problem that we have, though, is that people are waiting so long with their illness and coming in when they're out of the window for a lot of the treatment that we can offer. So one of the things that we really want to raise awareness of is if you're getting sick, you need to come to the hospital, or to your family physician to be evaluated, because there are some things that could potentially be life-saving that we can only offer out to day 10 of symptoms or from diagnosis. So waiting it out does not serve anyone well.
So I'm going to now go to the audience. We have several audience folks here today that have questions that they would like to ask the panel, so we're going to get started with that. So do you have a question?
Sure.
So introduce yourself.
Charles Briscoe, Oak Hill, West Virginia.
So Charles, what's your question for the panel?
I have a basset hound, and the lady that walks my dog came down with COVID. So now my dog is at my house. I'm wondering what I should look out for. Maybe the dog could transfer something to me, or should I look out for symptoms in the dog itself?
So maybe you, Dr. Stewart, that's probably more of a public health community. So I guess, again, the question is so someone that's walking the dog has COVID. Is there any way that you can get human to animal to human? Yes, so what would his concern be with that?
Yeah, I think the risk for you would be very low. If you know, particularly if she was just walking your dog, I think the risk for that would be extremely low. We do recommend that if you would have COVID and your dog would be around you, that you would not be like directly like kissing the dog or, you know, hugging the dog, that type of thing. But just trying to minimize contact in that case. But we haven't seen any reported cases of transmission from pets.
So I want to come to you. So Mr. Perdue.
Yes, sir.
So tell me your full name.
Rod Perdue.
And so, Ms. Perdue, do you have a question for the panel?
I do. For the first responders that are out in the fields every day, are there anything we could do different for the Delta, or just like the same CDC guidelines as before?
So again, I think that would go to Dr. Stewart, the health officer. Now we're talking about, again, transmission, community transmission. How do we reduce the risk and exposure?
The best way our first responders can protect themselves is by getting vaccinated. And what we know across West Virginia is that half of our EMS workers are unvaccinated. So to keep them safe and to keep our community safe, so they're available to be there when we need them, when we're sick or have an emergency, they first have to take care of themselves. And so to do that, we encourage them to be vaccinated. Other strategies would be to mask. So if they're riding in a car with a partner or something like that, they should be masking. Hand washing, staying home when they're sick, doing random testing is the best way.
So next question.
John Brenneman.
So what's your question, John?
With the original COVID, we were told to mask and stay 4 to 6 foot apart. With the variant, I've been reading several things that says differently, and I'm concerned with the events that'll be coming into our area.
So I think, you know, that's one thing, you know, I know we were talking a little bit even before we started the program, is this Delta variant. I think, you know, what is, you know, transmission, Dr. Stewart, as far as the infectivity versus the original strain that we initially saw out of Wuhan, China? I've heard that it's much more transmissible.
Yeah, so it is twice as transmissible as the original strain that we had here, which means, you know, before, one person that was positive could infect 2 to 3 people. Now that's more than doubled. And so it's as infectious as something like chickenpox would be. So I think it's important to know that people have a high viral load, which means they carry a lot of virus in their nose typically, or in their mouth. It's a mucosal virus, that's where it likes to live. But it spreads very easily. So there's even been reported cases and smoke outside that has traveled, and people that have gone into infected air and become infected. So it is more critical that we're practicing these mitigation strategies, that we are trying to distance and mask and hand wash and stay home when sick, as well as vaccinate to stay safe in our community.
So next question. So state your name.
Charles Smallwood.
And Mr. Smallwood, what's your question for the panel?
Could you explain when you need the booster vaccine? Is it really necessary?
So yeah, I've had a lot of people ask me that question as well. You know, we heard, I guess, on Friday that there's a third dose that is to be given to certain individuals. So So who, I guess, again, that would probably be more public health, Dr. Stewart, who should be receiving this third dose? And is it really a booster, or is it just a third of a 3 series?
Yeah, that's a great question. We've had lots of questions about that at the health department. So remember, this is a third dose. The difference between a third dose and a booster is that a third dose is for someone that has problems with their immune system. So someone that's undergoing cancer treatment, that's an organ transplant recipient, that's on medications that hurts their immune system, that like someone that has rheumatoid arthritis that's on methotrexate, that's an example, or prednisone. Those individuals would need extra help to get their immune system on board. A booster dose is someone that's already had the full series, that had a really good immune response, that then over time, that tapered down. And then after a certain amount of time, which we don't know yet, that person would need that booster dose. So 2 different types of things we're talking about. A booster dose and a third dose. So right now, the third dose is approved for immunocompromised, which makes about 2.7% of our population.
Yeah, on that same lines, I actually had a call-in question, Dave Perry, who his question was, he himself had received both shots, and he unfortunately was in an event where he contracted COVID. He then went and received monoclonals, and he's doing quite well. He's over 65 and he has hypertension. He's very interested in getting the third dose. His question to you is he eligible with hypertension and age greater than 65? Would that be considered immune compromised? So again, Dr. Stewart, maybe you can elaborate on that again.
Yes, so I can read you the exact requirements for that vaccine. It's acute treatment for solid tumors or cancer, recipient of organ transplants that have had a stem cell transplant in the last 2 years, severe immunodeficiency, untreated HIV, and under active treatments with corticosteroids or other immunomodulators. So that particular example would not qualify for that dose.
So speaking of that, though, I was curious. So prednisone, 20 milligrams or greater a day, and also, was it biologics as well? So if one of my patients has Crohn's disease, let's say, and they're on an anti-TNF drug, would they be eligible for that third dose then?
Yeah, anyone 12 and up that meets those criteria would be eligible for that third dose, and we would ask that they try to keep the same series. So if they had Pfizer for dose 1 and 2, that we would do Pfizer for dose 3, and vice versa for Moderna. Patients that have received Johnson & Johnson don't fall into this EUA. They did not get an EUA approval from the FDA to do this dosing. They're looking further into what to do in that category.
So it would be the 2 mRNA vaccines.
Correct.
And again, you got to be 12 years of age or older for Pfizer, correct?
And Dr. Conley, just to give a little broader answer about who's not eligible, we asked specific questions of the state today about our nursing home populations. Would they be eligible? Because they're at very high risk. Many are immunocompromised just by virtue of their infirmity and age. And we were told clearly, just because you live in a nursing home and you're old does not qualify you for a third dose, regardless of your health history, if you don't fit that criteria. So that matches a lot of people in the area.
Okay, so again, it seems like at this point, it seems like it's a fairly small number. You're saying less than 3% of the population would actually be eligible. And I know there's a lot of people out there that are wanting to run to the drugstore or to their physician to get that third dose. But the reality is that there's some, specific, requirements. Yes, sir, you had a question. So what's your name?
Yes, I'm Michael Martin. Good evening, doctor. I'm a 73-year-old. And in addition to having had both of my shots, Moderna, I have emphysema and I have asthma. This being an upper respiratory type of ailment, I'm very interested to know, do I qualify with those diseases?
So again, it's kind of back to he's aged. He also has emphysema, and again, so the concern obviously is what is your immunity, what's your antibody level, and again, would you benefit from a third dose?
Yeah, so right now he would not qualify. Now, whether he would benefit is the question, and we're all hopeful that as time goes forward, we'll be seeing that open up to populations that would also benefit. But right now, we're just stuck with that less than 3% who are immunocompromised under these very specific guidelines. But again, hopefully soon we'll have some guidance that we can expand that program.
So now the people that are eligible, I guess one of the questions to the panel is, when do you get the third dose? I mean, we know there's a separation. We don't want to stack on top of each other. I know when I received my first dose by Dr. Stewart, who gave me my first dose, I had to wait a certain amount of time to get the second dose. So let's say, you have an individual who unfortunately has yet to receive their vaccine. They've recently been diagnosed, with cancer. They're starting chemotherapy. They're like, okay, I want to get started on my shots. What would the interval be for the interval? And when do they get that third dose if they've already had their other 2 doses?
Yeah, so that third dose would need to be at least 28 days after the second dose in the series.
So, do you have a question?
Yes, I do.
So, who are you?
I'm Gary Hoke.
So, what's your question? What's your question, Mr. Hogue?
Well, I'd like to know what you're seeing the effects of COVID on our school-age children. Particularly, we know the unvaccinated population that we've had and what you've seen in the hospital stays and how that effect has been. And then any advice you can give to parents about sending their children to school. When is a proper time if they've been exposed to COVID in their family or are aware of that situation?
Who wants to take that one?
I can speak to that. Thus far in our community, we, in the emergency department and in the hospital, we've not seen a dramatic uptick in COVID in children. Across the state, there has been an increase in those cases. And of course, the average age, as we were talking about earlier, has gone down, is much lower with this Delta variant. That said, the population, especially with school starting, you can expect that we're going to see more and more of those cases. The cases we have seen in the emergency department have been, in children, have been milder, just as they were with the previous COVID as well.
So I guess a question that maybe I have for you on the panel, and anyone can take this one. Has it been proven that the Delta variant is more virulent than what we've seen before, whether it be the UK strain, Alpha variant, the original strain, or is it just more transmissible? I guess the question is obviously if it's more transmissible, you would expect that you're going to see by default more cases, but is it something that we're seeing that the people are coming in sicker? I guess that's my question with this Delta variant. So maybe you, Dr. Keffer, you can tell me what you're seeing in the hospital, and are these folks sicker than the folks you were seeing, let's say, around the holidays when we were having a surge at that point?
It's really difficult to make that comparison. It's all about when you come in. It's about what your viral load is. So we are pretty well established that the higher your viral load, especially at the time you contract the disease, really dictates how sick you're going to get. If something is more infective and creates a viral load of a high level more quickly, then when you give it to somebody else, you're going to give them more of an inoculum, more of a viral load than the others. So by virtue of that, we think that that's probably what is making people sicker. Now, treatments have changed. We have more availability of the monoclonals. The monoclonals have changed to a more effective agent. So we have more things to fight with and to fight this with than we did around Christmas time. So it's really a difficult comparison to make. But in general, again, if you're sick, come seek treatment. If you're starting to be short of breath, if you're starting to have pain, if you're having high fevers, come and let us check you out rather than wait until it's too late for us to do anything for you.
All right, it looks like we're coming up to a commercial break, and we're going to go to a quick break, and we're going to come back to our COVID town hall, and we're going to have more questions from the audience. So you folks stay tuned, and we'll be right back.
Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.
Town Hall COVID-19. We actually are here with our panel, and we also have our guests here in the audience. We've been asking a lot of good informative questions, and I think you have a question yourself. So tell me what your name is.
Michelle Holly.
So Michelle, what is your question to the panel?
So I've seen some things about different symptoms. Like, what's the most common kind of symptoms that people need to be looking for that say, I really need to go get checked?
So I think, that's a good question, maybe even to Dr. Curtis in the ER, because I think, this time of year, RSV, influenza, we've heard this a whole gamut of symptoms. So what symptoms, Dr. Curtis, she's asking, would you say, hey, I need to get a COVID test? I think, initially we were test. I think we're doing a lot of testing. I think maybe we've gone a little bit lax with testing. And so what should someone do to say, hey, I think I need to go to get, seen and evaluated for COVID?
That's a great question, and it's also a complicated answer because patients present with a wide range of symptoms. Commonly, we'll see people come in that are complaining of allergy-type symptoms or sinus infection-type symptoms. They may be even quite mild and will test positive for COVID. It's not always cough, headache, fever, which is also a common presentation, but particularly some of the symptoms are a little bit more subtle. In the breakthrough cases that we've seen, so those people who have been vaccinated who come in, their symptoms are often mild and could be attributed to things like allergies, that type of thing. The other presentation we see is gastrointestinal, so nausea, vomiting, and diarrhea sometimes are some of the presenting symptoms. And also the symptoms change during the course of it. So
that's a good question. I'm going to go on this side of the room since I haven't been over here yet, so I'm going to go over here and try not to trip. So you have a question, I know you do, so tell me your name.
Dr. Peggy Lambert-Fink, and my population are college students, and they will be worried about every symptom you just mentioned. And so at what point and where do we send them? Do we go for testing, or what's the steps they need to be advised to do?
So yeah, Dr. Stewart, so again, it's kind of back to what symptoms, and we're coming in the fall of the year, and how long do I wait in testing, and where should I be tested?
So I'm an advocate for testing early, because the earlier you would detect this, the less likely you would be spreading this. So as soon as someone would develop symptoms, I would encourage them to get tested. On the state's DHHR coronavirus website, there's free testing sites listed. In Fayette County, we have several testing options at all of the federally qualified health centers. They're testing every day. We test at the health department Mondays and Wednesdays, and we have free testing on Tuesdays at the Boy Scout Welcome Center there in Mount Hope. So the other option, if that's not available, is Walgreens. Most Walgreens are testing. And there's also over-the-counter test kits that people can purchase at any place with a pharmacy. If you would happen to do an at-home test kit and be positive, we would encourage you to get a confirmatory test, and that can be done at any of those other sites. And the other thing that's really important, while they're waiting for results, they need to be quarantined, or excuse me, isolated in, not going out, not being around other people until they would get the results. We see a lot of spread where people go get tested, and while they're waiting on the results, they're not isolated, and then they spread it to people that they love and community members that they're in contact with.
I'll add on to an answer about the symptoms. I don't think any of us would look at a patient with any presentation right now and say, that's not COVID, because there's such a varied presentation of very sick people and of people that came in with a broken leg that turned out they had COVID and they didn't even know it. So there's that wide range. So from a public health standpoint, absolutely testing early is of the utmost importance because we don't want to infect people around us. When the question arises about what symptoms should I have before I think about coming to seek treatment, so shortness of breath, high fevers that we mentioned before, but it could be as something as just as I don't feel right. I'm a little sweaty, I'm a little hot, I don't feel like myself, I'm a little achy. That could be a harbinger of severe disease on the uprise, and that's just something that, again, I can't stress enough that people should take seriously.
Yeah, and I think West Virginia W Tech, from what I understand, the students are being tested prior to going back this week. Is that correct? Yes, I did hear that the students have to be tested and are COVID negative before they start the school year. Provider, I know what you folks do every single day behind the scenes. I know what you guys do, and I applaud you folks for one, doing what you do and staying sane while doing it every single day. And I applaud you folks for coming to this town hall and giving us your story and hopefully helping folks that had questions. I also appreciate the audience, everyone that came here tonight. Hopefully all your questions were answered. Again, this has been a very special town hall. So at that, I guess we're at the end of the show. I'm Dr. Paul Conley. You've been watching Doc Talk. Until next time, have a good night.